All right, well, we're about three minutes past the hour, so I'm going to just get us started here. I'm going to share my screen. You're welcome to turn your video on or keep it off. I understand there are reasons to do both, so you know, feel free to do what's comfortable for you. As you can see, we have a good group here today, and we're excited to kind of share some information with you, but also learn a lot from you as well. So I'm hoping that you see some slides. I'm working on getting in presentation mode. Let's see. How does that look? Can I get a thumbs up? Can folks see an agenda slide? Okay, cool. Thank you. That's helpful. So I think I introduced myself, but I'll do it again. I'm Brittany Cooper, and I'm faculty here at Washington State University, and have a couple of other team members with me that I'm going to introduce in just a little bit. And but today's session, this is kind of what we're looking at. We're going to start with some just basic introductions. I'll set out kind of what our goals are for today. And then I'm going to spend a little bit of time talking to you about what are some keys to effective data storytelling. And then I'm going to hand it over to Gitanjali, who's going to lead us through a discussion of the CPWI community-specific handouts, which you should have all received, I believe, from Tyler. He said he sent out about 30 emails yesterday. So if you haven't seen that, you'll have to let us know, and we'll make sure you get the appropriate handout. And then we're going to leave a good chunk of time at the end, about 25 minutes or so, for you all to kind of reflect and review your own handout, and then hopefully share with some of your colleagues some ideas and thoughts about how you might use that handout in your specific community. So we will have some breakout room work towards the end of this session, and that's actually why Clara had asked for clarification in the chat box of which prevention system manager you work with, in addition to what community you're in, because we're going to try to group people accordingly. So we'll do that at the end, and of course there'll be time for questions and discussion, larger group discussion as well. So with that being said, I will start us off with some introductions. So myself, Gitanjali, Clara, and Jordan are all a part of the WSU Impact Lab. We're a group of faculty and students here that really have a focus on translating prevention science to practice, and that's kind of where our focus is in all of our work, and especially in the work that we do in collaboration with DBHR on the CPWI evaluation, is also really focused on not only kind of producing evaluation reports and research papers to describe what the impact of CPWI is, but also to hopefully convey that information in a meaningful, actionable way at the community level as well. So we really love doing this kind of work that we're going to talk about today, because there are many different ways you can use data and kind of cut up the pie, but in the end, we really hope that research and data can inform action and be meaningful at the community level as well. So that's kind of the main goal today. These are the specific goals we outlined for today's session. One is to help empower you to effectively tell your community's prevention story, to begin to familiarize you with those handouts that I mentioned, to help you interpret your substance use prevention data, and provide a couple of examples for how you might personalize the handouts that we'll talk a little bit more about later on, to suit your local needs. Because like we said, the goal here is to help you craft a story that is going to help you reach your community's goals by using the data that you have, and use that to inform how you discuss the impact of CPWI in your local community. So as I mentioned, I'm going to share a little bit about what we think are some keys to effective data storytelling. And so the kind of main question that we might ask ourselves is, why is it important to combine data with a story? Because we'll keep saying that over and over again, that data is not sufficient on its own. It needs to be combined with a story. We know from a variety of social and neuroscience work that information is processed differently when data is combined with a story. And so you can feel assured that this is evidence-based and research-based, this approach. The quote that you see on this screen here is from Brent Dykes, who has written a book on this topic, and I link to some more information on that if you're interested. And he says that people hear statistics, but they feel stories. And we can all probably relate to this either in our personal lives or our professional lives. But there is research to back up this kind of intuition. So research has shown that stories are more memorable than statistics alone. Also that when we combine data with a narrative, that information ends up becoming more persuasive and more engaging than if you were to only share statistics or factual information. And then, so another way to think about this is that the brain really works differently when it's trying to interpret statistics versus listening to a story, or at least that statistics in combination with the story can really help create this bridge in our brain and activate different parts of our brain that ultimately is more influential and kind of gets us at a more emotional level than, again, if we were only talking about data alone without that narrative and that story to go with it. So this slide, again, reinforces this idea that people tend to put up their shields when hearing kind of more dry factual arguments, but they tend to drop their guard when listening to a story, which can be a good thing because, especially if you're trying to present information, data to them that don't align with their kind of existing beliefs, they can really start to put up their guard and become cynical and really question the information that you're providing them, as opposed to when you combine data with a story, they tend to just be a little bit more open to hearing that story that you're trying to tell, and perhaps then ultimately taking action based on the information that you're trying to provide them. So there are three components to creating a good data story. Again, this comes from some of Brent Dyke's work in his book. We've got the kind of the dry information, the data, the statistics. You might think of that as kind of maybe the boring stuff. I don't know. I think of it as exciting stuff, but I'm also a researcher, so I selected into this field. That in combination with visual representation of that data and other visual depictions of kind of the story that you're trying to tell in combination with the narrative. So as the folks that work on the statewide CPWI evaluation, we can help provide you with the visuals and the data. And that's what we hope to do through those community specific handouts. But we really need you to help contextualize it with the narrative to tell your community's prevention story. And that's when we think you'll be most effective. So when you're crafting your narrative, there are a couple of key questions you want to ask yourself. So first, why do you want to present this data? It could be to raise awareness about the problem that's in your community. It could be to inform stakeholders about the work that you have been doing to address that problem. It could be kind of more of just a way to keep stakeholders informed about what you're doing, what efforts they're engaging in, how they're collaborating with you. And there could be a lot of other reasons why you might want to present data. In fact, I wanted to kind of pause here and just ask folks to either come off mute and share other reasons they have in the past presented data or other ideas they have for the future, or you can feel free to also dump it in the chat box. So are there other reasons beyond the ones that are listed here on the screen for why you might want to present data related to your CPWI efforts?
This kind of ties into everything that's on the screen, but it could also be to change existing perceptions about a problem. So people may know a problem already exists, but to kind of change how they view it. So for example, the COVID-19 pandemic, I think is a super good example of that.
Excellent, yeah. So try to change preconceptions or misperceptions, perhaps. Great. Anyone else have thoughts about why you might want to present data? How about seek additional funding or additional resources? You know, you certainly have requirements to report back to DBHR, but there might be other kind of organizations, foundation, other people that you might want to be working with to hopefully pursue other funding sources for your work. Anything else? Has anything come into the chat box? I don't think I've seen anything. Okay. It's hard. I can only see a subset of you on my screen too. Right, Ashley says inform stakeholders when activities are working and making impactful changes. Yes, definitely. Thank you. Okay, so this first question is important. Why do you want to present data? the next question is just as important. Who is your audience? So who are you wanting? It's, you know, goes in concert with what we just talked about. So this is a list of possible audiences that you might be targeting. You could be trying to target youth. You might want to be trying to better engage youth in your coalition work. Parents, caregivers, families, educators, legislators, either at the local level or the state level. Perhaps other people who you want to engage in the actual work of the coalition, you know, school administrators, funders, etc. So the kind of information there in the blue bubble outlines what you might want to think through for each of these audiences. So if you're targeting a specific audience, what's important to that group? What is their relationship to substance misuse and the problems that you're trying to target in your prevention work? What do they want to know? What do they need to know? And how much time and effort do they have to really devote to understanding and, you know, taking in the information that you're trying to give them? Because that can also frame how you present the information to them. So are there other audiences, obvious ones not listed here, that you want to make sure we add to this discussion? I guess we captured the major ones, sounds like. Okay. All right, well, I'll keep going ahead then. Other coalition members, yeah, so certainly keeping your own coalition members engaged and informed is really important. Local government, great. Another thing to kind of keep in mind, and some of you might be familiar with this from previous sessions that we've done either at the summit or the All Providers meeting. So there's a group called the Frameworks Institute who's done some research on communicating specifically about adolescent substance use. And so they suggest that it's important to frame messages about adolescent substance use with a specific technique. And they've actually conducted research on this to support this approach. So they say it's important to appeal to individuals and communities' moral responsibility, but if in combination with explaining the effects that substance use can have on the developing adolescent brain. And so they have some language here that gives a good example of how to do that well. And I would point you to their resources to kind of understand and better know like the rationale and reasoning behind why they came to this conclusion. We also have used some of these techniques in the handout itself, and Gitanjali is going to point this out to you, where we've made some adjustments in order to better frame our messages around adolescent substance use. So you'll see those in a little bit. They also, the work by Frameworks also suggests that metaphors can be really helpful in this area, especially when you're talking to a wide variety of audiences or the public in general. It can help correct, we're talking about correct misperceptions. It can help promote public support for a focus on protective factors. So this is another example that they use for the type of metaphor that they found to be most effective in this case. So they say, when adolescents experiment with alcohol and other drugs, it can heat up and boil over into a bigger problem. And so by creating environments that keep the heat down, we can prevent substance use from boiling over into a bigger problem. And the general idea behind this is that they found that in some of their research, the general public kind of has this somewhat neutral feel towards adolescents. They kind of envision that all adolescents are going to experiment with alcohol. It's no big deal. And so they've tried to kind of flip the switch a little bit to correct that misperception by using this metaphor. Okay, so in summary, the keys to effectively telling your story are know your goal and your audience. Don't overwhelm with too much information. We tend, as researchers and evaluators, we tend to do that and often have to be told time and time again, that's too much, it's too much. So we're always open to that level of feedback. Try not to get lost in the details. Use these effective messaging techniques along with data in combination with different ways of visualizing the data, and develop really a plan. And this is kind of all related to these things. So it's good to kind of have a proactive look at what kind of product do I want and what's my plan for disseminating that information. So I'll stop here and just ask if there are any general questions or comments at this point before I turn it over to Gitanjali, who's going to review some of those community-specific handouts with you and kind of talk you through what information is on the handout. So any general thoughts or comments, questions at this point? Okay, not seeing any. So Gitanjali, I'll have you take it away.
Thank you, Brittany. And now I will talk about the community handouts that you have received. And these handouts are based on the results of our larger community level evaluation. And based on those evaluation, we have developed these specific handouts for each individual communities. Brittany, could you please? Thank you. So as you can see, the handouts are two-sided. The first side has general information about CPWI, general results, and then also some context around substance use and some statistics. The first page is going to be the same for all communities in a cohort or a group of communities that started implementing CPWI together. It is the back page that can be personalized to suit the need of each individual community. And I will be briefly talking about the different sections of the handout. And I'll also be giving a brief example of some of the sample handouts that I've created. Next slide, please. Thank you. So here is the front page. And if you notice, we have started the handout by stating what CPWI aims to achieve. So according to the research that has been done, it is suggested that it is better to start with a broader impact than talking about what the problem statement is and reframe the message in a positive way. So what we have done is that instead of highlighting that adolescent substance use is a problem in our heading, we have instead said that local coalition approach can improve youth wellness. And this positive approach brings everybody together to work for youth wellness. And then next slide, please, Brittany. Thank you. So another thing that many people do, and which I have also done in the past, is that I start with statistics and basically say the substance use rate is this, and this, and then I was attending a webinar and then said, general public, they might not have any idea about what those statistics mean. Is 15% a high substance use rate? Is 15% a low substance use rate? Or some people might look at 15% and say, that's not that bad. Why do we need prevention? So the idea is that we should start our handout by giving some context on why adolescent substance use might be problematic, so that we can help the readers interpret why these numbers are important and why prevention is important. So that is what we have done in our handout. Next section, please, Brittany. Thank you. So in this particular section, we have briefly described what CPWI is. We have briefly talked about what it aims to achieve and how it is based on local effort, local coalition effort. And we have also provided a website for where people can get more information if they need to know more about CPWI. Next slide, please, Brittany. Thank you. And this is where we talk about the results of CPWI, or where we demonstrate that CPWI actually works. So in this section, we highlight some of the main results for CPWI cohorts or CPWI group as a whole. And in our evaluation, we examined pre-CPWI prevalence rate for various substances and risk factors with post-CPWI prevalence rate to see if there has been a change after CPWI has been implemented. And in the next step, what we have done is that if there has been a change between pre-CPWI and post-CPWI change, is the change statistically significant and is the change meaningful, so that we can say something more about how CPWI is affecting these substances. So these are the results from cohort 4 or group 4 that started implementation, I think, in 2015. So as you can see here, as a group, cohort 4 has made progress. 100% of the communities that have data showed significant reduction in alcohol use, cigarette use, and also in early initiation of substance use. So this section is also a place where we also identify any areas that might need further improvement or further work from CPWI coalitions. Next section, please, Brittany. Thank you. So this is the back page, and on the top of the back page, we have blocked out a whole section where you can personalize it to suit your own needs. Some of the things you can include here are a description of your coalition, talk about needs in the community, share success stories, give participant testimonials, provide photos. So it is for you to use as you see fit, and I will briefly give an example of how we have personalized this section later in the talk. Next slide, please, Brittany. Thank you. Now, this is the section where you can see the results of your specific community. The results for individual communities are shown on the same set of outcomes as are shown on the first page. So the idea is that the first page gives the reader a general idea of how the cohort or the group is doing as a whole. And on the second page, the reader can see how the community is doing in terms of all of these outcomes. Are they performing better than the group as a whole, or are they not performing as good as the group as a whole? So as you can see, the gray bar graphs are before CPWI, the blue ones are after CPWI. We have also shown whether or not something is statistically significant using an asterisk. And we also have a text box where we give a brief description of the results. And if anybody has any questions, please feel free to ask me later so that I can help you make the most use of these results. So next slide, please, Brittany. Thank you. So some of you might notice that your handouts do not have bar graphs. Instead, we have these general description where we talk about whether or not substance use and related risk factors have increased or decreased. And this is because we had to suppress these results because of low sample size. So whenever less than or fewer than 20 adolescents report using a substance, we suppress those results to protect the confidentiality of the students. And also when we use statistical tests with very small sample sizes, it might not be as reliable. So we will also show you how, if you have these kinds of outcomes without bar graphs, how you may be able to use them in your sample handout. Next slide, please, Brittany. Thank you. And could you please, thank you. So as you can see on the right, that is our first sample, and it is for Anytown Coalition. And as Brittany had mentioned, when we are trying to sit and create this sample handout, we asked ourselves the same two questions. Why do we want to present the data in this hypothetical coalition? And who is our audience? So after doing some brainstorming, we decided that we want to keep stakeholders informed about the efforts. We want to share our success stories, and we want to engage stakeholders in prevention efforts. So what we did was we provided a brief information about the coalition at the very top, and then provided a much longer description about the coalition at the bottom, and also gave information where community members or other stakeholders can engage with coalition members and be involved in coalition activities. We also provided specific instance of how youths are being engaged through these prevention activities, and how certain young adults who were involved in these coalitions, even after they have graduated from high school, they continue being involved, showing that these prevention activities are having a positive impact on the youth. So our general audience was general community members and parents and youth. So next slide, please, Brittany. Yeah, go ahead.
Actually, I just want to let folks know that Clara dropped these two sample handouts in the chat box, so you should be able to download them now if you didn't already have access, so feel free to do that.
Thank you, Brittany. And this is our second handout. And if you notice, this is for communities that do not have the bar graphs, but for which we just have the direction of change. So what we decided to do for these handouts was that we thought it would be really good to emphasize some of the prevention programming that is being implemented in the communities, and this could also be an effective tool to recruit participants. So we talked about Strengthening Families program, and we also gave a testimonial from a person who said that Strengthening Families program implemented in the context of CPWI really helped her and her children. So we also talked about how CPWI is one way of increasing how Strengthening Families program is one way of communicating with your kids about substance use and other issues, and that there is an upcoming program of Strengthening Families program 10 to 14, and we have given more details. And we have also highlighted that childcare is provided, that there will be dinner, there'll be weekly gifts, prizes, so that people might be encouraged to attend CPWI, saying, oh yeah, there are all of these perks available, so yeah, let's take advantage of this opportunity. So this is another way in which we can craft a narrative and then personalize the handouts. And that's about it very briefly, but again, please feel free to ask me if you have any specific questions.
Thank you so much, Gitanjali. So we'll give some time right now for any clarifying questions for Gitanjali, but also just to give you a heads up, the remaining time is really going to be your time to start strategizing and thinking about how you might use your community specific handout and tailor it to your community needs. And one place to start could be to review those sample handouts, get ideas from there, but you might have other, other methods, other ideas in mind. So it's really just meant to be a starting point for that discussion. So any general comments or questions for Gitanjali before we kind of break off into our groups? Okay. Because you did such a great job, Gitanjali. Thank you. So as I mentioned, I think the three things that you might be looking at this point, and if you don't have them in front of you right now, let us know so that we can make sure you get them, are those two sample handouts. And then you should have your community specific handout as well, which Tyler emailed folks yesterday, I believe. If you don't have access to those things, let us know in the chat box and we can do our best to get them to you. But our hope is that you'll take some time right now to kind of review those resources on your own. And then we're going to put you into breakout rooms where at least members of two different coalitions or communities will be in the same room. So that you can share ideas with one another, brainstorm, troubleshoot if you're, worried or have questions or concerns about how you might use the data or interpret it. And then we'll come back as a larger group in just a little bit and have some broader discussion. And certainly you can ask us questions then as well. Before we do that, I also wanted to mention, and this is on the very last slide as well, that if you're interested in scheduling an individual consultation with Gitanjali and I and our WSU evaluation team, please contact your prevention system manager and they'll help coordinate and facilitate that meeting. So like I said, why don't you take a minute or two to kind of start thinking about looking over those handouts and the samples, and soon you will see on your screen an invitation to go to a breakout room. Is that right, Clara?
Yes, I have one question. The Pacific County name on this, is that one of you who is actually in Pacific County on a different line, or is that a separate person? There are two of you. Okay, so
yeah, so I am the coordinator for R2R, and Darian is under that Pacific County name.
Oh, that's Darian.
And she works for us as well.
Great. Okay, thank you.
Great. So just to let you guys know, we're going to give you about 15 minutes in your breakout rooms to have this discussion, and then we'll call you back to the larger group. We are going to end at 5 till the hour because we have a second session with the next set of CPWI communities that starts right at 3 o'clock. So we need time to transition, but we should have time to come back and have some discussion as well. So 15 minutes in the breakout rooms, and we'll